My name is Sarah, and I'm a pelvic health physical therapist. I've been with Franciscan Health for 21 years now, starting in orthopedics and sports medicine, and over the past decade have really found a specialty area in pelvic health. I love this population because I can pretty much talk about anything with people and try to put them at ease. So sometimes we forget that men have pelvic floors too. Women get most of the attention because many of us choose to have babies and go through that trauma, but men have pelvic floors and they can also have pelvic floor dysfunction. Now, their symptoms are usually a little bit different. For most men that we treat, these men maybe have pain. And so that pain might manifest in some very different ways. So it might be some very lower abdominal or pelvic pain. It might be pain in the area where you'd sit on a bicycle seat. And their functional limitations might be they have pain with sitting and they have changes in their bowel and bladder function. One of the biggest changes that men will notice is urinary frequency and urgency. And that isn't just, a little bit. Some of these men are going to the bathroom every 15 or 20 minutes, and that's a major impact on quality of life. For treating men in pelvic floor physical therapy, much of the treatment is a little bit different. So instead of working to strengthen the muscles, what we are often learning how to do is to relax the muscles, to stretch the muscles, and then to address any back or hip dysfunction that might be contributing. Because a lot of these men, it's actually an orthopedic condition that started everything, and then they went into a protective posture with those muscles, and then they began to develop pelvic floor symptoms. So if you're a man and you're experiencing some of these symptoms, one thing that we don't want you to necessarily start with is just doing Kegel exercises. A lot of times when you hop online and you put in that I'm having urinary symptoms or I'm having urinary frequency or urgency, the internet is going to tell you your pelvic floor muscles need to be strengthened. But we know that for most men, this isn't the case. They don't have weak muscles. They have muscles that are tense. So one of the things that we find so very helpful and so very important is to learn to do what we call diaphragmatic breathing. And so that's a belly breathing technique that quiets our nervous system. It helps our abdominal wall expand. And most importantly, it helps our pelvic floor muscles to relax. When those muscles are relaxed, that helps with pain. And that helps with those annoying sensations of constantly needing to empty our bladder. If you feel that you could benefit from a pelvic health evaluation by one of our Franciscan physical therapists, visit our website at franciscanhealth.org/rehab.